Hi, everyone, and welcome to Aurora Recovery Center's first webinar. My name is Rabb. I'm the Director of Business Development and Public Relations Officer at Aurora Recovery Center. And we've decided to do some webinars this week on varying topics, on marijuana tonight, tomorrow night on alcohol, the third night on opiates and methamphetamine, then mental health, and lastly, interventions. And our main purpose of doing this stuff is to educate both public and those afflicted with some information around drugs and alcohol and the causes, the things that can cause problems when using drugs and alcohol, and specifically each individual drug. So tonight we're going to talk about marijuana and what qualifies me for this role as host is I'm 16 and a half years clean and sober. I was a doctor and lost everything to drugs and alcohol. And my gateway drug was alcohol and marijuana, and ultimately ended up using every drug, but mostly methamphetamine and opiates in the end. And so I'm qualified to be here, and I'm looking forward to participating with you and getting some good conversation going around different issues that affect all of your lives. And with us today I have Jennifer Hearn, and she graduated in 2015 from the University of Manitoba with a Bachelor of Social Work degree. And she has experience working with diverse backgrounds, spirituality, and cultures. She focuses on providing comprehensive, individualized care to help members at Aurora Recovery Center maintain an independent and healthy lifestyle. Welcome, Jennifer.
Thank you, Ian.
You're our expert tonight, and our topic again is marijuana. So I'll let you begin.
Okay. So I guess the reason why I'm classed as one of the experts for the evening is I have a personal interest in my counseling has developed from family and friends and myself as well, from recovery from addictions and experience with co-occurring mental health concerns. So today with the subject of marijuana, it was my drug of choice. I've been sober for 22 years. And actually the night that I was supposed to celebrate my 22nd birthday, I was on my way home to do an 8-ball, and I ended up in Sunnybrook Hospital with a mild stroke. So it kind of turned my life around and stopped me dead in my tracks.
Interesting.
Yeah. So the topic tonight is marijuana. One of the biggest things that I find that we get out of Aurora is, can you possibly be addicted to marijuana? And I think we're both sitting here as proof of, yeah, and it's usually a gateway drug to lead into bigger and stronger things, right? So I had started at a very young age, and the document's actually suggesting that people that start using at a younger age are at a higher risk for cognitive delay, mental health concerns, and possible stronger addictions.
So tell us a little bit about what you know about the effects of marijuana on mental health issues.
So with mental health issues, they're actually starting to realize that there's like a gender divide. So with women that are using marijuana in high doses or chronic uses of daily or whatever have you, they usually experience more anxiety, depression, social phobias, and all of that stuff. And it actually, if they've already experiencing it to begin with, and they're using it as a way to cope, it actually makes those symptoms worse. So it heightens everything, and they become more isolated and upset. Whereas men that are chronic users, especially at a young age, they become more aggressive, risk-taking, and doing defiant behaviors.
We know that marijuana has horrible effects on a young brain. What can you tell us about what you know about the effects on a young brain and the development of a young brain, male and or female, into chronic use of marijuana into adulthood, and the difficulties they have stopping using?
That's a very good question, because a lot of people believe it's just a plant and it's okay. But studies have shown that with chronic users that have started in the early teens and earlier, so under the age of 20, because the frontal lobe isn't attached, actually late into the mid-20s or whatever, if they've done studies, they've shown that the brain is usually a lot smaller. not by a significant amount, but it is a smaller brain. There is lower gray matter in the brain, and there's a higher white mass. And then with the mental health, if you're genetically predisposed, obviously the risks are higher, but you have a higher chance of bipolar, psychosis, even drug-induced psychosis, schizophrenia, depression, anxiety, low motivation, all of that stuff.
I know that we're seeing more psychosis and deeper psychosis with people that actually just want to quit marijuana. And I'm wondering, when I think about it, it clearly to me, besides the fact that it's much stronger, there's shatter now, you know what shatter is?
Yeah.
And there's other forms of marijuana and other ways to use it that is much more harmful. But I'm wondering now, if you have any understanding or any expertise on the fact that it's laced. We know that marijuana is laced with other things today.
Well, because they're competing with the other drugs, so people are using different ways, and you don't know what you're going to get in the marijuana that you're getting. So it could be laced with carfentanil, fentanyl, cocaine, angel dust, any of those things, and you don't even know. Yeah. So you don't even know that it's going. People are smoking it, eating it, or whatever. And the problem is especially when you've got younger people or people that are trying it for the first time and they're not realizing it, they have a higher risk of taking too much in if they're eating it, because the effect of the high doesn't start for much later. So they don't get that. So they just keep eating, and there's no way to regulate how much of something you're getting. Same as fentanyl. So it's actually a higher risk.
I think one thing that's really important to talk about when we talk about addiction, really, even though we're talking about marijuana tonight, that it doesn't matter what the substance is.
Yeah.
The addiction, and maybe talk about it a bit, comes from other things like feelings of conscious separation or not being a part of, or separation. People often describe it as feeling like there's a hole inside of them, or their skin doesn't fit, or they're, a square peg trying to fit in a round hole.
Yeah.
What is your experience in working with clients and your expertise around understanding that addiction is addiction, and the treatments for marijuana being similar or not similar to other drugs?
So a lot of them, maybe the side effects or the coming down off of it isn't quite as physically sickening, or it doesn't hurt as much as the other drugs, but the withdrawal is still very much there. So when they're coming down, they need to realize there is, CBT and DBT, motivational therapy and stuff like that.
Well, what is CBT and DBT?
Cognitive behavior therapy and dialectical behavior therapy. So they actually need those things to help them cope, because the idea behind addiction is something has happened in their life that they're not coping, they're self-medicating. So it could be a matter of having operational or disorder, ADHD that's untreated, depression, anxiety, could be trauma that's happening at home. So, an unhealthy lifestyle at home, social, economic needs are not being met. So maybe poverty, abuse, a parent that's an addict, or anything else happening. They're at a higher risk of self-medicating, and it's usually marijuana is the cheapest to get a hold of. So that's where it starts.
Okay. Evan, can we have the rest of the questions?
Yeah, I'll pull them up. Just one sec.
We had some questions from some anonymous people prior to the webinar, and so we're going to talk about some of those questions. And the first question is: what is cannabis a good harm reduction strategy for coming off opiates?
We talked a little bit about that before. It's actually a transference of addictions. So in the sense that you can't substitute one drug or one addiction for another one, right? So harm reduction would be, say, stop. If you were in the sense of smoking, you would replace a cigarette with, say, gum or candy or anything else. That's harm reduction. Harm reduction is not substituting one substance for another.
So the argument's going to be, that opiates and fentanyl and carfentanil and any of the opiates or morphine can kill someone, and but my son or daughter is just using cannabis now, or marijuana. Isn't that better?
No. So in that sense, and it's a clear no, and no is a complete statement in that, right? You're asking them, and you're okaying it to almost sacrifice, mental health issues, the psychosis, the possibility of psychosis, and the possibility of leading into more harmful things, and the dangers that they're putting in just because you think right now it's okay.
So what are the dangers of someone with an alcohol addiction that has relapsed a few times and then switching to marijuana in place of the alcohol, and now has an addiction to, and now in addition to the alcohol, they have a marijuana problem? So it's the same answer, basically.
Same answer, because they've just substituted one for the other. And eventually the brain, if it realizes that it likes the alcohol better, it'll actually get them to drink again. It's just one bone is connected to the other bone kind of thing is what we tell people.
Is marijuana a depressant?
Yes. So people believe that it actually makes them feel better because it numbs things, but it actually makes symptoms worse for depression, anxiety, and social anxiety and all of them.
Okay. What about how successful are regular users of marijuana in quitting? And I guess the definition, you'd have to define what a regular user is. There's, year is a regular user, daily is a regular user, years is a regular user. But what are the difficulties that regular users of marijuana will have in quitting?
Well, I think one of the biggest things is they do have, they go through withdrawal because of the dopamine is not being rushed as quick as the other one. But also I think you have to understand when you say regular users, is that like a normal user? Because some people can go and they socially get high. Those people are going to have an easier time. Whereas somebody who's a chronic user and uses daily and can't remember the last time they were sober, their success rate is going to probably be about as high as anybody else that quits an addiction. As long as their determination and their motivation is there and they're willing to do the work, they can be successful.
So they have to look at the pain inside or the reason that they're using the marijuana.
Exactly. And they have to do the work to be able to fix that.
But Mom, it just makes me feel better.
No, it doesn't, Mom. It just numbs me.
Right. I mean,
yeah.
We are educated, so it's really easy for us to say that. But when a kid comes to their mom and said, no, I get along better with my friends when I'm using marijuana and I relate better to them and I'm much more creative and I can get my homework done. They don't really realize what it's doing to the brain because it's creating some form of pleasure or idealization.
And basically what they're really saying is, Mom, I'm struggling and I have no coping skills and I don't know how to deal with life.
One of the other questions was from someone that said they'd been on the floor after smoking pot a couple times in recent days. And they said not even that much pot. And they said it was really scary. And the question was, is there a good chance it was sprayed with something like fentanyl or other things?
There's a good chance it could have been laced with anything. Like I said, I've heard of people watering their marijuana plants with Windex. So people would get a stronger high or whatever hobby, right? So there's no way of even guaranteeing because you don't know where that source is coming from.
Well, talk a little bit about the treatment of clients coming in with marijuana as a primary addiction. What would it look like? What would their time in treatment look like? So
their time in treatment, it depends on where they go. It's usually 30 days, but the recovery is a lifetime. It's not just the 30 days. The 30 days after detox is what gets them that foundation of starting to dig deep, starting to work on it, going to therapy, going to classes, and learning those positive communication and coping skills so that they're able to recover in life without having to fall back on something to self-medicate.
But what does a day look like in those 30 days? How is someone going to start identifying with wanting to be clean off marijuana? And what are the challenges they're going to be faced with besides the initial 72 hours of craving it physically, which goes away because cravings go away after these substances gone from our body. And also, what is the timeline? We know that marijuana stays in the bloodstream a lot longer than most other drugs, actually. So what is the timeline for someone to be absolutely clean and free of marijuana?
That's a hard question to answer because when you say clean and free of marijuana, they can be after up to 2 weeks, but they're not really, depending on how long they've been using and everything else. It takes a while for the brain to readjust and to rework itself and to get used to doing things. So the pleasure synapses and everything else have to be recreated. Fogginess, all of that stuff has to come back. So where they actually think that they're thinking clear when they're using marijuana and they're actually not, they're just tricked into believing that. In my experience,
in the last 16 years of working with mostly men that have come off of marijuana and other drugs, but mostly marijuana being the primary drug early, I find that their brains remain sticky for a couple of years. Like there's a difference. You always know a past chronic marijuana user. They just don't have the ability to connect with things as quickly. They don't learn as quickly. It just seems like it takes them a little bit longer to get rid of the social awkwardness. What can you tell me about what you know about that?
Well, they've actually done studies. So chronic users, even when they've gotten off of it or whatever, it's exactly like you said. They can show them photos or give them examples of people showing emotion or starting to, so happy, sad, angry, or anything. And they actually are unable to recognize those things as quickly as anybody else. So if they're communicating with somebody, they don't know maybe how they're feeling or how they're going to react until it's too late. And it's because of that fogginess that they don't realize it's there. So they have to actually rework the brain. And unless you go into treatment and you get all the background information and you know, okay, crosswords or even Jeopardy or any of those things, you don't realize just how much work you have to do to get your brain back up to full speed, and if you can. So, and one of the problems with marijuana, especially when people come in after with other addictions, is they tend to forget that the addiction started with marijuana. So they live for a while under the impression that they can go back to smoking marijuana and they'll be fine because it wasn't a problem when they smoked marijuana.
So I come into treatment and I tell you, I'm a chronic marijuana user, but I don't have a drinking problem. I don't have an alcohol problem. I don't use it very much. I'd much rather marijuana. Don't you think I could drink a little bit?
Only the person knows that. I can tell you from personal experience. So I don't drink very much. And if I do drink, it's in a very controlled and special occasion. And I always ask myself, do I need this drink or can I go without it? And if I need it, then I absolutely don't touch it. And because of that, that's because being an addict, I know that it's quite easy that maybe drinking wasn't my problem before. But now that I've given up my drug of choice, I'll easily fall into something else.
As long as I want to mind alter. Depends why you take that drink.
As long as I want to self-medicate and as long as I want to fit in or socialize. And that's usually why people drink or do drugs or anything, right? Is to fit in. Once they become addicted, you notice they start to isolate more and hide it, which is usually when they know that there's a bigger problem than what they want to admit.
Okay. Are there any questions? How do I know I'm addicted?
Exactly. So if you're using it to self-medicate, if you have poor coping skills and you can't adjust to daily life, if you can't go out without it, you can't wake up without it, you can't get out of bed without it, you can't talk to your parents without it, you can't socialize with your friends without it or go to school, even go to work, you know you have a problem.
Jennifer, I just use marijuana on Saturday nights. But I use a lot of it and I eat a lot and watch movies, Netflix. Could I be addicted?
You could be just as easy as somebody that's a binge drinker, right? They're an alcoholic. They may say, I only drink 3 times a week or I only drink once a month. It's the same thing.
Is the recreational use of marijuana harmful then?
To me, yes. I'm an addict. There is no recreational use. If somebody else can do it, then maybe that.
I guess you'd have to define recreational use.
Exactly.
Just like I talked about just a minute ago, if I just use in excess just one night a week, that could be considered recreational use for someone. I always go back to, and you can tell me if you resonate, I always go back to, how are you feeling? Do you feel disconnected and not a part of? Are you feeling adopted in your perfectly normal family?
Yeah.
Do you have an emptiness that you're filling? You have to ask those questions. I don't think it really matters if it's once a day or once a week.
That's right. Or if you're going home and going, oh crap, that was such a rough week. I can't wait to go home and smoke a joint.
If that's what you think about first thing in the morning, I can't wait till the workday's done so I can go
Friday.
So I can.
Then you have a problem.
What are the long-term effects of marijuana use? And you talked about some of them. I know you have a few other things written down.
Yeah, so most of the long-term use, like I said, is the cognitive delay. The reasoning is a little bit shortened. There's no active time response from what you're seeing to your action or anything else. So driving or anything, everybody is at risk. They don't realize it. And actually, it's more increased when you're driving than with alcohol. And then most people smoke marijuana and drink. So the chances of an accident are even higher.
So this is a question that I never, ever answer. because I don't think it's my business, really. It is my business, but it's not. I always say that, if you want to, I tell young people that I work with all the time, if you want to use and drink, that's your business. But if you want to quit, it's mine. And the question that's often come up with me is, is the legalization of marijuana in Canada a good thing? And, so I know it's really that's opinion based. We don't really know. And I know what my opinion is. I know that I have nephews that think they'll say, but Uncle Ian, it's going to be legal next year. Like, wake up, grow up. So do you think it's a good thing or a bad thing, the legalization of marijuana in Canada?
I'm of the standpoint that it doesn't matter if it's legal or illegal. I'm an addict and I can't do it. So I don't think the legalization is going to produce more addicts, but I don't think it's going to lessen addicts either.
Does it give Does it give a wrong message to our youth?
I believe it does. We don't have enough education around it, and a lot of youth actually have been known to say that it's just marijuana and it's okay, without getting the education of the possible psychosis, bipolar, schizophrenia, or any of that stuff. None of that stuff is being taught.
So tell me a little bit about the psychosis and schizophrenia, or what you see, or what parents might witness, or like what goes on with the use of marijuana that causes those things.
So marijuana, it's playing a part in the receptor, so it's cutting off the normal receptor reactions that they're doing, and it's actually replacing it with the high. So psychosis is a matter of an altered state of reality. So you can have a person that now thinks they're Superman and they can jump off of a 5-story building and fly. You can think of them where you hear people feel that their parents are now aliens and talking to them in a different language. Somebody's chasing them, any of that stuff. That's the psychosis that can happen. Unfortunately, a lot of people believe when it does happen, it's an isolated incident and something was laced, when that's not the case. It can actually be the marijuana itself.
So is the psychosis permanent? Often I hear of, all of a sudden a diagnosis is made, a mental health diagnosis is made based on someone that's used a lot of marijuana. And does that go away? Do we know?
Sometimes it doesn't. So sometimes it could be that they were predisposed to maybe having schizophrenia or psychosis or whatever. And then with the use of marijuana at a young age, it's just kick-started that and increased that chance of getting it.
I really would like anybody that's participating with us tonight, I'd like to thank you. But most importantly, I'd really like you to submit questions as well. We have a few more, but this is for you. So please feel free to submit your questions. And while we have Jennifer Hearn here to answer them, it would be a good time to get those questions to us. Jennifer, another question that came up was, how do I approach my kid about marijuana use without scaring them? How do we talk to them about the effects of it? And, often a parent doesn't know if their kid's going to be an addict or not. So what do we say, and how do we approach them without scaring them, and at what age?
I think it starts very young and in schools and at home, and maybe we can provide the materials needed for kids. So it's not trying to use a scare tactic. It's just information-based and fact-based. So being open and honest with your kids and encouraging them to come to you.
Should I allow my kid to smoke marijuana at home, who's underage and not legal to smoke it?
You want my professional or personal opinion? It's the same.
You can give both.
No. So as a parent, my job, and I believe anybody's job as a parent, is you need to be a parent, not a friend, and not anything else. So by doing this, you're actually saying it's okay that you might get psychosis. It's okay if I have to take care of you for the rest of your life. Or it's okay if I have to pay for your recovery or treatment or anything later in life, because this is how your addiction is.
But Dad, there's always alcohol in the house, and you drink every Saturday night.
Maybe Dad's not an alcoholic. Okay. And he's also of age to do it, right?
Yeah, it's legal.
Yeah.
Can you say more about harm reduction? You mentioned it earlier, but you didn't say much, and I wonder what your stance is on it. I know that, and I'll just briefly, I know that harm reduction really started as a public health issue. Like that was the real definition of harm reduction, is let's reduce the harms to public. When it came to needle exchange, and ultimately the transition of sexually transmitted diseases. But harm reduction has taken on a whole new meaning over the years, many meanings over the years. What is your stance on it, or can you tell me a little bit more about your feelings or what you understand about harm reduction?
Harm reduction is very tricky because we implement something and we hope for the best, but it takes a long time for us to notice that it's actually harm reduction. For instance, vapes. They were made as a harm reduction to get people off of cigarettes and to save on the cigarette smoke and everything else. And then same as the oils and stuff being put in them for marijuana, and that was all used as a harm reduction because it was better for you. But they're actually realizing now that people become almost more addicted to the crutch than they are the drug. So they're not getting any farther ahead. They're just getting farther and farther involved in the addiction. So harm reduction for marijuana, there isn't really anything to substitute marijuana right now. There's a spice that's used that's illegal in most places because it actually, some of the things that have come out that people thought were better are actually more harmful.
So you have, that's all you have to say about harm reduction?
Yeah, there's just nothing that they've actually come out with that I'm aware of that's good for harm reduction except don't use.
So it sounds like addiction is really the key, and that teaching positive ways of coping is the real answer. And that's correct.
That's correct.
Okay, so let's talk again about a little bit more about addiction to marijuana, and how what kind of coping skills that we use to teach people. What are some of the examples of positive coping?
So positive coping, it would be like, it's led by example as well. So if you had a tough day at work, you don't go and, tear a strip off your partner, kick the cat, do anything like that. It's positive coping skills. So being able to set healthy boundaries and teaching kids to set healthy boundaries so that when they grow up, they can. So knowing when they've had a rough day, they can open up the lines of communication and they can express themselves effectively while being able to own what they're feeling and be able to process that.
Okay. So in talking to your kid that, wants to experiment with marijuana, do you start talking to them about positive coping skills?
I think,
or ask them why they feel like they have to use, or what the purpose of them getting high is?
Exactly. It would start with, why are they wanting to experiment with it? In my experience, professionally and personally, somebody doesn't come and just say, I was having a great life, everything was going well, so I decided to get high. It just doesn't usually happen because all the dopamine's running through them naturally and they just don't have that need or whatever. It's when things are going bad, either they're insecure, they're getting bullied at school, any of that stuff, they're coming home and they're not able to cope with. So that's the root that you need to find out, is what's going on in that child that they feel a need to experiment.
Okay. There was a question about, I thought marijuana was a natural drug and safe to use.
So thinking that marijuana is a natural drug, that's the way that it got in. There's a lot of drugs that are used to help people and to medicate with people and stuff like that. Alcohol can be made with potatoes, barley, whatever. It's all the same. It doesn't make it safe to use.
So just quickly, one thing for the public to know is there's been a question of where can I find a link to this discussion so that I can ultimately pass it on to someone I know. I have a friend who's got a daughter that's got a problem, and I'd really like them to see this webinar. And just so those that have registered will receive an email with a link within a few days from now, and they'll be able to log on to YouTube and view this webinar once again. If you didn't register, you can go to aurorarecoverycenter.com and register anyways, and you can also participate in the webinars the rest of this week.
Yeah.
Every day at 7 p.m.
Every day at 7 p.m. Same time, same place, different topic. Are those some more questions, Evan? Yeah. Is medical marijuana different than the kind that I'm buying from my dealer?
Yes. So medical marijuana is actually strictly regulated. The THC is removed, and the THC is actually the component that's causing most of the damages in the brain and in the system. So by using medical marijuana, you're using something to help alleviate pain, nausea, or anything medically related that doesn't get you high because there's no THC.
It really helps my anxiety.
I would argue.
Mom, when I smoke pot, it really helps my anxiety.
So that's the numbing of the feelings and the emotions. So you're just numbing everything and getting it high, and you're putting like a clamp on all the receptors to stop those feelings from happening.
If I enjoy alcohol casually, can I enjoy marijuana casually?
Sure. There is some people that do, right? Again, if you're going out and you're not using it as a stress relief or as a coping mechanism or as a way to socialize because you can't socialize without it or anything else, and you're just going to do it, then yeah.
All right. Is the damage that marijuana causes to the brain or marijuana addiction is it reversible? Do we know?
They haven't even finished to see what extent it is. They do know that there's a lot of work that needs to be done. I don't know if I mentioned earlier, but they've actually now shown that children that use marijuana in the young teens, later in life, the chronic users have actually come up with the smaller brain. So that's obviously something that's not going to start to grow again.
And are there withdrawal symptoms related to, when people come into detox? What are the withdrawal symptoms related to marijuana addiction?
So a lot of it is anxiety. Maybe you can't get out of bed. You're sleeping all the time. You could lose your appetite, fever, chills, all of that stuff. So a lot of discomfort, but most of them, for the main majority of the side effects, are just the same as quitting smoking.
Okay. Where do I start to get help with coping without smoking?
Pardon?
Where do I start to get help with coping without smoking marijuana?
So there's lots of information online that you can go to and many places that you can go to that just gets you help. I would suggest a good foundation like AA or NA or anything like that you can go and you can get fellowship support from. We also have art counseling here in Scarfield in the city. So it's not a 30-day intensive in-house treatment like we have in Aurora and Gimli. It's actually you come in and it's an outpatient. So you can be with people and you can get the counseling that you need to provide you with those skills.
Now, can you provide at our counseling, if I'm a parent that's having problems with my kid who's using marijuana, will our counseling also provide counseling to families?
Yes, we have an intensive programming for families. You can either do it 3-day intense therapy or over 6 weeks. And you get the background information because recovery is a family disease and it's something that parents have to get into as well. So it gives you a better understanding of if you're enabling codependency, what to do, how to intervene and all of that.
So addiction is a family disease. So I'm a parent with a kid that's using marijuana. What did I do wrong? I don't have a problem.
You didn't do anything wrong. And that's the first step. It's because actually most parents feel like it is their fault and immense guilt, and that actually inhibits them from helping the child move forward.
We also know that that addiction, often beyond being genetic, potentially, there's a link or a history somewhere of past trauma, be it real or fancied. Or big or small. It could be a small trauma like not making a hockey team, or it could be a big trauma like sexual or physical or emotional abuse from a parent or bullying. Tell us a little bit about your understanding about trauma as a precursor to people that become addicted.
So because again, not having those coping skills, so especially with being young or even a young adult and having trauma happen, if you have no way to express it or nobody to trust or counseling or anything, we internalize it and we almost get trapped. So like you said, without making a hockey team, if it's an 8-year-old boy and that's all him and his father did all the time and everything else, he internalizes that because he doesn't want to express that. That's something that affects his relationship with his father without him even knowing it. well into his early teens and adulthood until he receives treatment.
And so ultimately, someone like that might go to marijuana or other drugs to numb the pain, and also ultimately it causes, I think you're saying, it causes a problem with the development of the relationship with the father, with the father, which could cause further trauma, really.
Yeah, and then within himself, like you said, not fitting in his own skin or whatever, so he doesn't know why. He just knows that he doesn't feel good. Well, at that age, he wouldn't identify it to that instance, but carrying on, it could be then getting called out in class or getting picked on at school or anything else. They internalize that as children, and then that comes out later in life.
So is treating an addiction, any addiction, including marijuana, and I always hear people say an addiction is an addiction. It doesn't matter what it is, but we're treating the addiction. Is that the case with marijuana too?
Yep, you have to treat the addiction. And then by treating the addiction, it's actually because you got to go deeper than that. The marijuana is just somebody's way of putting a bandage on whatever's happening and covering it.
Oh, so marijuana is the symptom to the problem.
I guess you could say that.
Because that's what we see. We see someone using too much marijuana. We don't see the other stuff.
We don't see the other stuff. That's right. So
for parents that don't know, marijuana becomes the symptom. That's what we see.
And we've had people come in where it could be intergenerational trauma. So something that's not even happened to the child, it's happened in another generation and it's just been passed down unknowingly. Or it could be even family secrets from 2 generations or 3 generations back that get carried forward. So yeah, all you see is the addiction and you don't see what's going on.
So is there a higher chance of a marijuana user going to, say, alcohol or benzodiazepines or opiates because they're all downers versus going to transferring their addiction to cocaine or methamphetamine or uppers?
I don't think there's any study to say one or the other. It's just that there's a 17% chance among chronic users to use a much stronger drug and to go forward. So somebody using marijuana doesn't know they're taking a depressant. Alcohol is a depressant. Most of them are depressants, but they don't realize that. So there's no really way to gauge which way they're going to go.
Thanks. Very informative, Jennifer. Thanks for that info. Again, we have some more time. We really would appreciate your questions. So if you're joining us on this webinar with Jennifer Hearn around marijuana use and the use of marijuana, please submit your questions for her to answer.
Oh, got one here.
Oh, we have another question. What can I do at home now to address my heavy marijuana use? I'm sitting at home right now. I'm watching this webinar, and you've ruined my marijuana smoking for the evening. So what can I do if I want to start some form of reduction of use of my marijuana without going to treatment right away?
I would call you can do things like call the Aurora hotline. There's always somebody available that can talk to you and really sit down and actually start looking at what's going on and why you're feeling and what led you to even be smoking in the first place, but also realize that you know something's going on because you tuned into the webinar. That's a great first step because you're sitting there and you're asking and you're contributing and you're saying, okay, I have a problem, because why else would you be checking into us, right?
Well, yeah, when we were talking a bit earlier, you talked about a couple good documentaries. Or good resources or good places for knowledge around marijuana use for family and friends, or even those that are afflicted and using too much marijuana. What were those?
Yeah, so there was one that's a 5-part series called Clearing the Smoke on Cannabis. And so that's the impact on the cognitive, functional, and mental health. And that goes through more of what I was talking about. So it'll give you more effects on what's going on in the brain and everything else and how it's impacted it and the long-term effects and the short-term. And then there's another one called The Effects of Cannabis Use During Adolescence. And I would recommend any parent to look at that, like you were asking about, if my 13-year-old wants to use, should I let them? I would recommend they actually get the knowledge behind it before they just, because sometimes it's the parents doing the same stereotype. It's just marijuana.
I'm so frustrated. I'm so frustrated with my sister. My sister smokes marijuana in front of her kids. and I go over there with my family, and my kids think they should be able to smoke marijuana too, because it's legal. What do I tell my kids?
Well, for one, I don't know if your sister's aware, but
it's on my sister's.
I know. Okay. The THC, hypothetically,
yes.
The THC is actually in the secondhand smoke. So you're actually putting the THC in the air for the children, the babies, any of those things. And then also, I wouldn't be going over to my sister's if she was doing that. Never mind bringing my kids. So
okay, and can you tell me 2 actual coping mechanisms for dealing with my feelings so that I don't have to smoke marijuana?
I would suggest doing a mind-body scan. What are you feeling right now? Why are you feeling it? What's going on? And are you actually in the present and not in the past?
So let's do that a little bit. Take some time to do. Tell me but if you were sitting with someone, how would you get them to go through their mind and their body and scan it?
So for starters, if it was somebody with past trauma, so PTSD, I usually get them to either hold on to a chair where they can feel with their hands or ground. Yeah. So it's a matter of you're connecting to the chair. So you feel you're in the chair. And then if you slowly start to relax and you're able to close your eyes, I ask you to focus on your feet. And when you're drawing in, I want you to feel the power that's coming in your feet. Do your feet feel tense? Are they, are your feet cold? Are they tingly? Anything else? And then moving on to your knees, your stomach, your chest, your shoulders, your head, your neck, and being able to tell where your tension is. The thing is once you're drawing your attention to all of that, whatever's creating that in the past is kind of like gone.
So what is the coping strategy then? I can't
be mindful.
So I can't just do that. I'm at home and I'm a marijuana user, and
why can't you?
And I'm still high. So how am I going to get in touch with the
coping when you're high is not going to happen anyway.
Okay, so
because you're already high, but it's coping before that, and it doesn't matter. And maybe you can, agree or disagree with me, but it doesn't matter how long you've been sober or you're in sobriety. It's minute by minute. And right now in this minute, I'm sober. I'm not worried about in 100 minutes from now if I'm going to be sober. I take it minute by minute, day by day, hour by hour.
So for those people that want to quit marijuana, they don't have to quit forever. They just have to quit till bedtime and go to sleep and wake up the next morning and stay quit. They just have to stay quit a day at a time.
A day at a time. Work on today. I'm sober today and I'm working on tomorrow.
So once they're past that detox period, again, what are the 2 coping strategies that I can use for dealing with my feelings?
So dealing with your feelings, positive communication and boundaries are the 2 biggest things of why people have a hard time coping. So they're either a people pleaser or, and it creates a lot of resentment and anger within them. So they use that as a way to suppress that feeling. So being able to relate positive boundaries and to say your positive boundaries.
So when in your professional opinion will rehab or inpatient treatment or recovery treatment become a necessity? Like when does it become absolutely necessary? And how do we determine if it's worth it?
It's your life. So it's always going to be worth it. So you can stay wrapped up in the addiction and keep going farther and farther in the hole. You can actually step out of that and do something about that, right? If a person is using all the time and everything else, that's the time they need to step out. That's when they need recovery. That's when they need to ask for help.
All right. So even if someone comes into rehab and comes out and ends up using again, planting the seed is what's important. Getting them to start thinking about being mindful around their addiction and why they're using, and ultimately trying to get rid of some of the pain.
Exactly. So planting the seed and hoping some of it waters when they leave. So we sometimes will have people come back, or people will realize, okay, I had a slip. I need to pick up. I need to go to AA.
Do most people, or Narcotics Anonymous, or Cocaine Anonymous, or wherever they go, or Marijuana Anonymous, do most people relapse on their drug of choice? So if my son or daughter comes to treatment and they leave, is there a better chance for them to relapse on marijuana or on some other drug or alcohol?
in my experience, it's their drug of choice. It's what they usually go right back to, because their brain's calling for that, because that's the high that they already know. So if they're in pain because maybe they weren't forthcoming in treatment or anything else, and they leave and they're in pain, their body's automatically screaming for the one thing that it knows it's going to stop that.
This mother wants to know if 30 days is enough for marijuana addiction for treatment. Should their son go away for 60 or 90 days for treatment?
So 30 days, 30, 60, or 90 days is just the start of your child's recovery. There's no set time. It depends on, why they're coming into treatment. Is it by choice? Is it an intervention? Is it an ultimatum? How serious they are, their programming, how much work they put into it to say if it leaves. So
the latest research that I read, and you can tell me if I'm accurate or not, says the longer the person can remain in treatment or in some kind of functional environment or sober community, the better chance of long-term sobriety or long-term being clean. My understanding is at 60 days it doubles. It's 2 times the chance. Someone that goes into sober living post-treatment, it's like 15 times. So why, in your opinion, does longer stays in treatment provide better opportunity and better results in recovery?
I think for one, you get to more of the root of the problem. You have longer time working on it, but also, just like AA, NA, and all of them, it's peer-based. It's a supportive network and system. So you're actually replacing all of the old, maybe dysfunctional relationships with a lot of positive ones, right? So they build connections within, say, Aurora, and there's a very strong base that's built around there. So they have a very strong support work of people that understand them, but that have been a part of the journey with them.
I know Carl Jung, who's a psychologist, spent a lot of time in actually working with people with addiction, and he said one of the best significant value, there's a significant value in creating an environment. What did he say? He said, honest communication with friends, protected by the walls of human community. So is that what happens in treatment? Is that it gives you're given a safe place in group to share your emotions, your feelings, and ultimately learn better coping mechanisms?
And not be judged.
And not be judged. Can you learn better coping mechanisms well in a treatment-based facility, in or outpatient? Or a member-based facility like Aurora, or ultimately, can you do some of this work at home?
I think you could maybe read the information at home, but to be able to apply it. So one of the things that's great about residential treatment like Aurora is that there we're working on the basis of knowing somebody. We don't have a history. We've never been lied to by the person. We've never watched them, well, with a few exceptions of them coming in intoxicated or high. For the most part, we get to know the person, and it's a very honest realness to them, where they can come in and they can be honest, and they know that we can accept them the same as their peers can accept them at a base value for who they are, so that they can actually learn who they are without the drugs or the alcohol influencing that.
Once again, we're nearing the end of our 1-hour webinar with Jennifer Hearn on marijuana. So it's your last chance to submit questions. Please feel free to do so as soon as possible. We appreciate everybody that's been sending us questions thus far. And we're here to answer any further questions for you. Tomorrow's webinar will begin at 7 p.m. again. We'll be looking at the subject of alcohol. A great reminder. If you want to a reminder, or you want to register, please again go to aurorarecoverycenter.com. Some of the questions we will answer include: how do I support my partners in recovery? What is my role? What is the success rate with using the 12 steps as opposed to not using it? Coping with the guilt of leaving the alcoholic, knowing there will be a relapse. What do I do when my loved one does relapse? So that's going to be tomorrow. And once again, we're here for another 10 minutes. If you have any questions for us, please submit them.
I just wanted to point out that if people are, even if it doesn't matter what the drug of choice is or what the addiction is, I think that if somebody's looking for information, they would benefit to watch all of our webinar series, even if the one addiction doesn't apply to them, because they'll start to see a common theme and get more information out of each of them. So like when you were talking about discussing about 12 steps and the success rate of it as opposed to not, that's something that very much also can apply to marijuana or gambling or any of that, right? Because it's the 12 steps and it's a very fundamental core.
Is there a lot of process addictions that go together with marijuana addiction? Do we find a lot of marijuana addicted people are gamers and sit at their TV, or Netflix addicts, just sit there for hours? I know when I was smoking pot, I had a problem with Oreo cookies.
I've never heard the Oreo cookies, but a lot of gaming and stuff like that, yes, because then gaming actually becomes a part of the addiction, right? It's an altered sense of reality. So you're living in the reality of the game, you're not in the real world, and then you're smoking marijuana and you're isolating from everybody else because almost like you're living in that video game now.
Okay, and what about, I started talking about alcohol and the fact that we're going to discuss that tomorrow. What are the effects of mixing alcohol and marijuana?
You're
17 years ago, I would have said great. Today, I know differently.
So I was, yes, exactly. So the thing is that, like I said, with the cognitive delay and stuff like that, but it's also a depressant, and so is alcohol. So they've actually proven, like, especially at a young age, a child, say, at the age of 15, that's a chronic user of marijuana or marijuana and alcohol, at the age of 16 or 17 is more likely to attempt or have thoughts of suicide. So you see the impact when, especially when you start compounding addictions, right? So if you've got marijuana and then you're adding alcohol into it, or Oreo cookies, and then you're adding gaming, and then you're adding all of this stuff. So you're just getting them, you're going farther and farther down the hole because just the marijuana is no longer good enough.
When I was a marijuana smoker, I thought I was a really good artist.
And were you?
Not really.
Okay.
But I just think it's funny. Like your mind is so corrupt to how you're living and thinking and behaving that you actually think you're doing something really good and you're not. And it's really affecting your whole life. So we only have a few minutes left. And if there are no more questions, I don't know, is there anything you'd like to add personally around this discussion of marijuana? Any other information that the questions didn't answer that I might have missed or that you might have missed to kind of close off the session?
No, I think there was actually some really good questions, and it was very insightful to hear some of the questions that people are actually thinking. I think one of the great things about, especially where we are at Aurora, is that when we have people come in and seeing that growth from starters of, well, when I leave, I'm still going to smoke marijuana because it's not that bad, to sometimes that light bulb going off and saying, okay, it's not okay.
Yeah.
I'm an addict and I'm addicted to it.
Do you have a lot of people that come to treatment on other drugs, but be it amphetamines or cocaine or opiates, that leave trying to believe that they're going to go smoke pot because it's okay?
A lot of them.
Yeah.
Yeah.
Marijuana maintenance program.
Exactly. And then a lot of them, they don't realize the risks, including, like, they didn't realize that they've had one of the biggest things is they don't know if they'll get it back is, like, sexual appetite and stuff like that, because marijuana just plays a role in all of that for men and women. Yeah. It plays with the testosterone and stuff like that, so it just lowers. So
there might be a problem. All right. So just again, thank you very much for participating in our webinar tonight. Thank you, Jennifer, for your expertise. We really appreciate all of you joining us, and we look forward to you joining us again tomorrow night. Please, you can send questions anonymously prior to the webinar tomorrow through the website, and please join us tomorrow with all of your questions related to alcohol.
Thank you.
Bye, everybody.